Good afternoon, everyone. This is School Care's quarterly membership update. Today is Wednesday, February 4th. I want to thank everyone for joining. Please note that the session is being recorded. Microphones will be muted throughout the presentation. And then when we get to the Q&A section, we will unmute when folks raise their hand. We will also have the chat feature available. I'm Lisa Duquette, the Executive Director of School Care, and we appreciate you taking time for this quarterly membership meeting. Today's meeting is focused on stewardship of the shared risk pool that all of you collectively own and govern. Our goal today is to provide clear financial transparency, share what we've heard from members statewide, update you on the progress since the annual meeting, and outline the next steps ahead. But above all, we want to maintain member confidence through trust, clarity, fairness, and predictability, and to reaffirm our commitment to you. This is really our why slide. We are, as I said before, committed to communicating clearly and consistently, and not just when things are easy, but especially when conditions are challenging. The pool belongs to the members, and because it belongs to you, we believe you deserve straightforward information and shared understanding, including what we know today and what we're still monitoring and decisions that are coming next. Here's today's agenda. We will start with a brief leadership update. Then I'll walk through financials and operations, including financial condition, and we'll cover claims trends and the latest on the payment of the assessment. Mandy, our Director of Member Engagement, will share member engagement highlights, renewals, and what's coming next. And then we'll leave time at the end for Q&A. So as I said, we'd give you a brief leadership team update. Joining me today are Jen Burke, Director of Finance, and Mandy Grenier, Director of Member Engagement. Before we move into the agenda items, I also want to note two recent leadership changes. Jeff Kantorowski retired at the end of December, and we're grateful for his years of service and leadership. We also want to acknowledge Melissa Perot's resignation and 18 years of contributions to school care and the members we serve. As always, our focus remains on continuity of service, stability for members, and a smooth transition as their responsibilities are reassigned. These are the items that I mentioned earlier that I would be covering in my presentation. So before we get into the numbers, I want to ground us one more time in the fundamentals of risk pooling under RSA 5B. School care exists to help self-insured public entities, school districts, towns, quasi-government entities, charter schools, etc., reduce health insurance costs by spreading risk across the larger group. Public entities across the state choose to join together and self-insure, and to do that collaboratively. Members own and govern the pool collectively. And that structure matters. Unlike traditional insurance, there's no profit margin built in. Administrative costs are significantly lower, which means that more of every dollar stays in the pool to support members, paying claims and benefits, rather than going to shareholders. That said, pooling also means that we share both rewards and risk. When the pool performs well, surpluses can be returned to members, such as through the $90 million in contribution holidays that we've provided over the past decade. However, when experience is unfavorable, we have to respond together to protect the long-term sustainability of the pool, and that's what we did this fall. This shared ownership model is exactly why transparency and predictability are so important and why we're here today. On the financial front, I'd like to begin with an important update on the June 30, 2025 audit. It has now been finalized and was formally accepted by the board on Monday of this week. As many of you are aware, the audit process was paused during November and December. That pause was intentional and appropriate. It was driven by the need to confirm assessment payment status and ensure that there was clarity and confidence in the path forward for school care. Now that those confirmations have been completed and the audit is finalized, we're back on schedule with our financial reporting and transparency commitments. The June 30, 2025 audited financial statements are available on the school care website. They were posted today after being approved on Monday. Transparency for school care is not optional. It's foundational to the stewardship and to the member trust. This slide shows a high-level snapshot of school care's financial performance across the last 3 fiscal years, plus a mid-year check as of December 31, 2025. Please note the June 30 figures are all audited figures. The December 31 numbers are unaudited and prepared by management. The key takeaway is that in fiscal year 2024 and fiscal year 2025, both years, operating expenses exceeded operating revenues. This resulted in those operating losses that you see in the chart. Fiscal year 2025 reflects the most significant loss shown here, about $27.3 million from operations and a $25.1 million change in net position after non-operating revenue. Non-operating revenue is investment income, as a side note. The December 31, 2025 numbers show improvement. At the midpoint, where we are in the fiscal year, we are showing an operating gain of $31.8 million and a change in net position of $32.3 million. This is the direct result of the $30 million contribution assessment issued on October 1st, 2025. It's important to note that this is a mid-year snapshot and not a year-end result, but it does show that the actions taken and financial adjustments that were made moved school care to a financially stable position. Net position is an important measure of financial strength. You saw it on the previous slide. We're going to dig in a little bit more here. It is also a reminder of the responsibility we have to maintain adequate reserves, to protect the pool, and meet member obligations. This slide shows the change in net position over time, essentially whether the pool gained or lost financial position each year, and where school care was at the end of the year. For example, in fiscal year 2025, the pool had a negative change in net position of $9.5 million, which brought ending net position to about $20.4 million. In fiscal year 2025, school care experienced a larger negative change, about $25.1 million, which again resulted in the ending net position of a negative $4.7 million that was reported at the annual meeting. The December 31, 2025 checkpoint shows improvement. The pool's net position increased by $32.3 million, bringing the ending net position back to the positive at approximately $27.6 million. And net position plays into contingency reserves. So again, another really important piece of information. This connects the net position to what members actually care about: financial strength relative to contributions, and whether reserves are where the actuary recommends. This chart shows 3 things: school care's ending net position, the actuary's recommended reserve level, and then that calculation that you've probably heard many times, we've talked about, and certainly the legislature has, about the net position as a percentage of member contributions. The actuarial recommendation is essentially a benchmark. It's what the actuary believes school care should hold in reserves to protect the pool and meet obligations. As of June 30, 2025, net position, as you know, was negative at 4.7 million. In comparison, the actuary's recommendation was that school care should be holding 34.1 million. And net position as a percentage of contribution was a deficit of negative 2%. That's why corrective action and shared stewardship have been necessary through the assessment. The estimated December 31, 2025 numbers again show significant improvement with an ending position of 27.6 million when rounded. That's tremendous progress, and it reflects that school care, we collectively, you as the members, are rebuilding stability. At the same time, the pool is still below the actuarial recommendation of 34.2 million. So the work isn't done. Our focus remains on continuing to rebuild financial strength in a disciplined and predictable way. And this is expected to be accomplished through contribution rates beginning with July 1, 2026. This slide outlines our financial next steps, and these are the themes you should expect us to repeat consistently. We will monitor projections continuously to support timely decisions. We will govern through updated board reserve policy as the decision framework. We will adapt as state legislation changes program requirements. And we will communicate through quarterly updates like this because shared understanding is essential in a member-owned model. I'm going to move to claims and provide you with an update. And I'd like to begin by framing it this way. Claims remain the primary driver of cost in the pool, and it's the area where we must be the most clear-eyed. On this slide, you can see costs and trends. Total claims trend for the first 6 months of this fiscal year is 11.9% over the same period last year, with medical at 10.8% and pharmacy at 15.4%. Now, a few key highlights. Fiscal year 2025 medical claims runout came in about 548,000 below actuarial projections. That's a good thing. So when you looked previously and you saw net position as a percentage of member contributions, you may recall from materials that school care put out that the board was looking to bring that to 12%. And so part of the reason why it's above 12% is because at December 31, an additional 548,000 was added to the net position as a result of claims runout coming in below the actuarial projections. Moving to the current fiscal year 2026 medical claims, for the first 6 months, claims are running 101.2% of projected. That would be the actuarial projected based on rates. We would want that to normally be running between 90 to 92% of rates, of contribution rates. Now, if we dig a little bit deeper to that, what is driving that? So specialty RX continues to be a major driver with a 23.1% increase in spend. And you can see on the chart or in the materials, the top conditions, they remain the same: arthritis, diabetes, and cancer. We are also continuing to see increased high-cost claimants. Those would be those large claims over 75,000. The number of individuals with claims over 75,000 increased nearly 39% in the first 6 months of the year compared to the prior year. And the spend for those individuals increased just under 24%. The top conditions, again, remain much the same: cancer, musculoskeletal, and gastrointestinal. The important takeaway is this: even when overall claims run above projections, There are some offsetting actions that we've shared with you that are already underway. And those include Cigna administrative fee reductions, performance guarantee payouts, prescription drug improvements, all of which are expected to have reduced the net impact. And in addition to that, we also have the premium deficiency reserve. So those all together are what puts school care in a favorable position as we approach the next 6 months of the plan year. Next is the assessment and payment plan slide. First, I want to acknowledge we know this has been difficult. Assessments are not easy. Certainly my first time and New Hampshire's first time. They require trust in the process and fairness across the membership. As of January 31st of this year, the deck reflects the current status of the assessment totals and payment plan participation. So you can see here that 88 out of 90 groups have paid or some payment, and 67 of those 88 groups have paid in full, while 21 have entered into payment agreements, where at least 1/3 had been paid by December 31st and the balance due by July 15th, 2026. 2 groups have not entered into an agreement or paid, and this represents just over $3 million. So the second chart where you see approximately $27 million confirmed for July 15th, 2026, the reason why it isn't $30 million is because of the other 2 groups that have not made a payment. I want to just share that our commitment remains. We will apply the assessment consistently. It's very important to protect the integrity of the pool, and we are continuing to work toward full participation in a fair and predictable way. I'll turn it to Mandy next to share some highlights, but I want to emphasize engagement is not a nice to have. It's how we ensure the plans work for the people enrolled in them, and it's how we support employers as they navigate a complex benefits environment.
Thank you, Lisa, and hello, everyone. Thank you all for being here today. We know that when times are challenging, engagement matters more than ever. And this year, we leaned heavily into being present, accessible, and responsive. So as you can see on the slide here, we have met with members and those on our plans in a variety of ways, both virtually and in person. First, if you look to the left, the first section shows at the very broadest level, we prioritized open, accessible forums for conversation. We hosted 4 all-member meetings, which included a town hall, 2 public hearings on rate setting, and our annual meeting, which this year had the highest attendance over all previous years. These settings were intentional. They gave us space to share information openly, answer questions directly, and ensure members understood not just what was happening, but why. We listened to our members and brought back ideas that help shape how we navigate these challenging times. Another key area was individual and group-specific engagement. We conducted more than 30 one-on-one and small group meetings to review claims data, utilization trends, and cost drivers, particularly for groups with over 100 employees where these impacts were most significant. We met with your employees to explain their benefits. We held EAP seminars and presented many wellness workshops. And this is where we took the time to explain the new well-being platform to drive even higher preventative care, awareness, and engagement. These conversations allowed us to move beyond general information and focus on what was happening with each member group. That level of high-touch service builds confidence and helps members and employees make informed decisions. Another area where we are continuing to engage your employees is through the Recharge Challenge. And as you can see, that engagement in the challenge has been fantastic. And as of this morning, only 3 days into the challenge, and despite the cold weather, we have 151 teams, 567 participants, and over 8.4 million steps logged. That's nearly 5,000 miles. This is very impressive. And some of you on this call may be involved in the challenge, so kudos to you. Next, I want to highlight the open enrollment and retiree engagement. We also held 7 65-plus open enrollment meetings, reaching 386 individuals through those meetings. And that's not counting the folks who came and visited us in the office and reached out to us through a phone call. The purpose of these meetings and individual interactions was more than plan selection. It's about education and making sure people felt supported while they were making their decisions. So when you take a step back and you look at this collectively, what stands out here is consistency, transparency, and leading into conversations with our members, supporting your employees, and making sure your retirees are engaged as well. We believe that this approach is foundational to trust, and it directly connects to the confidence that we're seeing from members today. The takeaway here is that we're not only managing the pool financially, we're also investing in member experience and long-term health outcomes. And we're also proud to share with you that School Care has been recognized as Cigna's Healthy Workforce Designation Gold Level recipient. That's the highest level available. And we got that for helping employees not only be healthier, but more productive and engaged. Now let's talk about membership renewals. This is an important slide and a very positive one. As of today, 87 member groups have returned their renewal form. That represents 93.8% of our membership. If you had asked us 4 months ago what this slide might look like, the honest answer is we didn't know. 2025 brought real challenges, and yet here we are. That's not luck, that's trust. Our members understand how pooling works. They understand shared risk, and they understand that School Care is built for the long term. This outcome came from working together every step of the way. You stayed engaged, asked questions, and shared your insight. You know us, and we know you, your communities, your employees, your retirees, and the realities you're navigating every day. And that relationship matters. Together, we're building a strong pool for today, tomorrow, and most importantly, for the future. We don't take that confidence lightly, and we remain committed to protecting the strength of this pool together. So before we move on to questions, I want to share an important leadership update. After more than 30 years of pooling leadership and 20 years of dedicated service to School Care, Lisa has a planned retirement date of June 30th, 2026. This transition has been thoughtfully planned in partnership with the board. An ad hoc committee has been formed, a search firm will be utilized, and a nationwide search will begin February 16th. The board is taking thoughtful, intentional approach to the transition, keeping members at the center and supporting stability. School Care's mission, values, and commitment to you remain the same. And we'll continue to keep you informed as we move forward. And we look forward to reconnecting at our next quarterly meeting on May 14th. So save that date. Now I'm going to hand this over to Jen Burke, who will be doing the moderation here for the Q&A section of today's meeting.
Thank you. That concludes the formal update portion of today's meeting. We'll now move to Q&A. Microphones are muted by default, so please use the raise hand icon at the top of your screen and you'll be prompted to unmute when it's your turn. You can also drop questions in the chat if you prefer. I will moderate and we will do our best to answer all questions. And I'm just going to spotlight Lisa again. So we did have a question that was entered in on the chat earlier. Is the estimated ending net position of 27 million the estimated position for June 30th, 2026?
It is not. That is the estimate as of December 31st, 2025. I would
Okay.
expect it to be similar, but it is not the projection for June 30th.
All right, Peter, you should be able to unmute yourself and ask your question.
Thanks for the presentation. It was very clear. Since we are in the middle of the legislative session, is there any legislation that we should be aware of and keeping track of that might affect school care next year?
We're following a few pieces of legislation. Excuse me. We have Senate Bill 605, which moves assessments, which would move assessments to be collected over a 3-year period of time. And school care did, I was there yesterday in Senate Finance and did testify and explained that if that were to proceed, that school care wouldn't be here today. But I also did speak to higher reserve levels and greater transparency and notifications to members to avoid any perceived or real surprises in the future. Today there was House Bill 1491 that was heard in House Commerce that conflicted with this meeting, but that is a repeat of Senate Bill 297 from the last session. And Senator Carson did have a late bill that she brought to the Senate, and it is yet to be drafted, so we have not seen a copy of it. But we are continuing to follow all of these. I don't see anything in these at this time that are a threat to school care's stability on a go-forward basis. And in fact, we believe that if some of these were presented other than the one yesterday, that actually it could further strengthen school care's financial position through the allowance for greater reserves.
Go ahead with your follow-up, Peter.
Yeah, so one of the shocking things to everybody is just the expense of medical care, and school care is a pass through, like you allow people to get the care that they want, like the money to pay for all those claims. The real problem, of course, is just the incredible expense. Since you all live in that world, school care, you all live in that world every day. I'm wondering if you have any insight as to what could change that would help control those costs, and specifically if there's anything that the New Hampshire legislature could be doing to lower costs for public employers in New Hampshire.
That's a big question, Peter. I'd love to take that offline and chat with you, not because I wouldn't want others to hear, but that is a huge undertaking. We can look at some of our neighboring states and see things that they have done. Vermont recently, their legislature entered into an agreement with one of the large hospital systems to cap the costs for public employers for healthcare. There are some things to do in that area. But what I would also say to you is that when you squeeze a system in one area, it is going to burst in another area, and it is going to be cost shifting. So if hospitals do not receive the rates that they have contracted for and instead are subject to lower rates, that does mean that it's going to move to the private sector. It does mean that there are going to be other costs in low income Medicare type or Medicaid type plans. So it's a very difficult question that you're asking, a very complex question. And quite frankly, one that, in my opinion, this is a personal opinion, really needs to be addressed at a national level. This is not just a New Hampshire problem. This is a national problem. Thank you for those questions.
At this time, we do not have any more hands nor questions in our chat.
Thank you, Jen. So I'll wrap up just by saying we appreciate your partnership, your engagement, your commitment to the shared risk pool. Our promise is to continue leading with clarity, fairness, and predictability, and keep you, our members, informed every step of the way. Thank you.